Did you know hands washed with soap and water can prevent deaths from diarrheal illness by 50%? Did you know washed hands can prevent the spread of respiratory infections like common cold by 16 to 21%? Did you know appropriate hand hygiene in the hospital can reduce the risk of acquiring a new infection in the hospital by 50%? Such is the importance of a simple act of keeping your hands clean. Hand hygiene has already proven to be a key measure to prevent the spread of infection by SARS-CoV in the last 3 years. Germs that cause diarrhea such as E. coli, norovirus, rotavirus, etc., and those which cause respiratory infections like adenovirus, flu virus, or even SARS-CoV can spread from objects that are contaminated by these germs. Now, these can be common objects like your door handle or even electrical switches. Now, how did these bugs land on these objects? Now, a person who is infected may cough or sneeze on these objects, or may have coughed or sneezed onto his hand and touch these objects, transferring these bugs. When you touch it, you end up getting contaminated by these bugs and transferring onto yourself. We have the habit of touching our eyes, nose, and mouth without our knowledge frequently, and this may become a portal of entry for these contaminated hands. Unwashed hands can also transfer these organisms onto food and water, which again can cause infection. A conscious hand washing can actually break all these chains of transmission and keep you and your dear ones safe. Hand hygiene also has a very important role in preventing antibiotic resistance. Now, what is antibiotic resistance? You might have heard of what is called superbugs, which are creating a havoc in the treatment of severe infections. Now, superbugs are organisms which are resistant to the most common and the most effective antibiotics, and making the treatment of infections very, very difficult. Antibiotic overuse, in fact, is the pivotal cause for propagating antibiotic resistance. By washing your hand, you're reducing the chances of getting sick. In turn, reducing the chances of using antibiotics. This in turn will prevent the emergence of antibiotic resistance. And also, you are preventing the infection by these superbugs, which again, as I mentioned, are very difficult to treat. The key moments when you have to do hand washing are before, during, and after cooking food, before eating, before and after you nurse someone who is sick, before and after you touch a wound or a cut, after using a toilet, after touching pets, after touching garbage, if your hands are visibly dirty or contaminated, if you have sneezed or coughed into your hands, please wash your hands immediately. Thank you.